massage nurse. Today I'm going to bring you a video on the low back, and I'm not just going to focus on the muscles. Today I'm going to talk about the low back tension, which involves not just the muscles, but ligaments, fascia, and what holds the spine together. I'm going to focus a lot on the lumbars and the sacrum, and I'm going to talk about the ligaments. So I'll be teaching you on how to release that thoracolumbar fascia, and I like to explain to you how it works, and think of this like a suspension bridge. So the vertebrae right here, these vertebrae will be like the towers, and then the ligaments, the Iliolumbar ligament and the Lumbosacral ligament, all of these ligaments here, and the thoracolumbar fascia, all of that is what holds it steady. And then the muscles would be the adjusters. So imagine if you have a ligament, which these are the cables, the ligaments are the cables. If any of these are off, it's going to pull and throw the bridge off. So I want to talk to you guys about that and show you how you can work on some of these ligaments, plus the thoracolumbar fascia, plus the muscles. So on the low back, one of the main ones that gets affected is the Quadratus Lumborum. And remember, the Quadratus Lumborum is the deepest muscle. So you can't really palpate it from here, but I'm going to show you how to work on it with a tool. So I want to start by doing, just a little bit of rocking motion here. Just back and forth. I just do one hand over the other one. I'm trying to do some oscillation here with my hands to warm up the fascia. Remember that the fascia, if it's not hydrated, it's really hard to have any kind of a glide. So you can tell more or less if a person is dehydrated if you see no glide. She's got a pretty good glide, so that means that her fascia is hydrated. I'm also going to show you how everything's connected. When we say that things are connected and everything's connected, and then you go, well, how is it connected? Well, think of the origin of the lat, and then it inserts at the intertubercular groove of the humerus, almost on the anterior part of the humerus, and this is the insertion, and this connects to the thoracolumbar fascia, and then this connects to the sacrum, and it connects to the also the obliques, the internals and external obliques, and the transverse abdominis. It connects the thoracolumbar fascia, connects to that, and then it connects to the sacrum, and then the sacrum connects to the Sacrotuberous Ligament, which inserts at the ischium, right where the hamstrings originate. And then the hamstrings go down from here, So imagine from here, all the way down this way is the route. If anything's off, it's going to affect the whole body. Or vice versa. If your hamstrings are tight and they're pulling, you overwork your hamstrings. Let's say you overwork your hamstrings and these are tight. They're going to pull down. So the tension is going to start from here and move up all the way to your arm. So it can start from the arm to here, down, or it can start from here. See, you can even see if there's a lot of stretching here from the hamstrings, it's going to pull on this ligament here. So it's very important for you to address everything here. So I want to start with even some grasping of the fascia, just kind of lifting. My thumbs aren't too flexible now, so I can't do the skin rolling too much because my thumbs really hurt. After 38 years of working, they hurt. So I can try to do some of the skin rolling, from the bottom up or from the top down, whichever one. And I can do some C-bowing. Now the lat covers the bottom part of the scapula only, okay? Only the bottom part of the scapula, and it inserts in the intertubercular groove of the humerus, along with the teres major, which is right here, also helps the lats. That's a synergistic muscle, and the lat will be an agonist. muscle. So I'm just doing some grasping of the skin, some skin rolling. And if you can pull it up and pop the vertebrae, that's even better. She's very flexible. If it hurts on your client, don't do it. But if it doesn't hurt, you can go all the way up, just lifting the fascia. And like I said, my thumbs hurt now, so I like to use just my whole palms just to lift too. All I'm doing is grasping. You can do two hands or hand over hand, especially the thoracolumbar fascia. You want to grasp it and move it. Did that hurt? No? Okay. So I'm just grasping and lifting, grasping and lifting. Getting some movement there on that fascia. So after we've warmed up, we can even do some stretches. I'm holding the ilium here, the top of the ilium, and then I'm stretching away. With my right arm, I'm stretching away. Up, holding the ilium, and just creating some stretches here, all the way up. Be careful here with the floating ribs. Remember, we have the floating ribs, right here. So be careful not to push too hard. But I didn't draw the QL on this side because I wanted to draw the fascia here. But it is underneath. And like I said, it's the deepest muscle. So you want to pull away. Brace here with your left hand and then just create some fascia stretching here. And you can also do that with the sacrum. You want to push down on the sacrum and just pull back with your right hand. We've got the sacroiliac joint. Sacroiliac joint, people think that it's small. It's not. Imagine this is the sacrum. And it joins the ilium with the sacrum. So if the sacrum is this length, and I palpated on her. And remember when you're palpating that you do it gentle, that you do it with your finger pads. You do gentle palpation so your client doesn't feel too uncomfortable. So I feel the edge of her sacrum right here. So this is her sacrum and this is the ilium. So this is the sacroiliac joint. And this is the only joint in the body in the lower part that joins the axial skeleton with the appendicular skeleton. So this joint joins your leg with your axial skeleton, okay? So this joint right here is very important. You can pull down on it and then, do a separation, a little bit of a separation. People that have sacroiliac joint pain, it is really painful. So now I'm going to talk about the iliolumbar. Okay, the iliolumbar ligament is from the lumbar 4 and 5 to the ilium, and this is where I use my tool. You want to get, you can do it with your thumbs if you don't have the tool, or with your finger pads, and just kind of rock it back and forth a little bit. Try to loosen up that ligament. But I like to go in with a tool, just find the top of the ilium, and then it's right here. This is the one I drew here, right here. And then you just go in there and try to scoop up that ligament. Did that hurt? No, your body just kind of jumped up a little bit, so. So I'm trying to loosen up this ligament here. The iliolumbar ligament. And of course you would work the one on this side too. The lumbosacral ligament is between L5. This is where L5 sits on the sacrum. This whole thing right here is the lumbosacral ligament. And that can also be really tight on people. So I would get to the top of the table and just kind of stretch it out that way a little bit. Create some movement on there. because the lumbars are a little flexible. The sacrum is very, stable. So this joint a lot of times can cause a lot of problems for people because it's carrying the whole axial skeleton, and this is the base. So a lot of people have pain here. And so, or you can also use the palm of your hand just to create a little bit of rocking there, a little bit of motion, and it can tell you, how much movement there is here if it's stuck, if the ligaments are really tight. And you can also go in, I would use this one's a little bit flatter and just go all the way along the lumbosacral, between the lumbar L5 and the sacrum. So this sits right here on top. Now this is where I drew the thoracolumbar fascia, okay? It goes here. I didn't want to cover the sacroiliac joint, so I kind of drew it above it, but it's like a triangle. It's like from here to here. So you want to make sure and lift it even here. Lift it, lift it. You can do with your hands or with your fingers, the skin rolling, lift all of this here. And these foramen, are the ones where the nerve and blood vessels come out through, where the sciatic nerve comes through. The sciatic nerve it's got 5 roots, from L4, 5, and then S1 and 2. And so it comes through here, and then it goes to the anterior side, and it comes out through the greater sciatic foramen here that goes down the leg. And then the piriformis muscle that's right here sometimes pinches that sciatic nerve that's underneath here. Okay, so now let's talk about the sacrotuberous ligament. So this is the sacrotuberous ligament, and it's from the sacrum, and it tapers down, and it inserts right at the ischium. The ischium is the bottom, is your sits bone, and then the hamstrings originate there. So one of the things that you might want to do is, even just with the palm of your hand, what I'm doing is I'm holding here and then just massaging it. And you can work over the clothes. I'm just trying to show you so that you can visualize it. Here's the end of her sacrum. When I turn her sideways, I'll be able to show you how to drop the leg from the table so that you can get a good stretch here. Okay, so you can even go with your finger pads and just work it down. Cross fiber. You can do cross fiber. And just make sure you work the sacrotuberous ligament all the way too. And also it connects with the glutes. I didn't draw the gluteus maximus, but it's right here too. So imagine the lats, the quadratus, the obliques, and the gluteus maximus. So all of this, and down to the hamstrings, all of it connects. All of this connects. So you got to make sure that you work the fascia, the ligaments. Okay, so after grasping, this is another one that I want to show you. You go to the ASIS, the anterior superior iliac spine. On the anterior, here it is. So I'm going to do some rocking here. I'm going to put both my thighs against the table, and this is all I'm doing is just rocking her pelvis a little bit to create some movement here. And after I rock it for a little bit, then I leave my left hand there, and then with my other hand, actually I'll do my fist. I will hold this steady here so that I can do some rocking so this doesn't move, and maybe get some more motion here on the sacroiliac joint and all the joints here. Okay, so that's to get some pelvic movement. I'm going to work the QL. I know the QL is really deep. It it originates right here. Let's pretend that it's drawn on this side, and from the transverse processes to the iliac crest. So I'm going to come in from the side because this is the belly of the muscle. So it's about an inch out. Be careful with the floating rib. Don't push on the floating rib. You come out about an inch out, and you can really get, to get to the belly of the Quadratus Lumborum. Now, if you have a heavy person, you might not be able to reach it, but it's to me, the L bar is more effective than my finger pads because I don't have that much strength anymore. So mine, and it's you can also get an elbow in there if you can. They find relief also with an elbow, but I love the tools. You can either use the flat one or you can use the bevel tool to really get underneath there. Not just the lumbosacral ligament and the iliolumbar ligaments here, but also the QL. And you want to work just mainly on the belly of the muscle and the origin right here on the iliac crest. So now you want to work the lat. The lat originates all of here on the iliac crest too, and it inserts all the way up to the arm. So you can lift. You can do the C-bowing like I showed you at the beginning. You can do some of the massaging. And on the sideline, I'm really going to show you how you can grasp. And actually from here too, if you pull down on the scapula, you can really grasp the lat right here. Remember that the lat forms the posterior axilla. So this axilla right here is from the lat. So if you push down on the scapula a little bit, then you can really grasp it and start releasing some of the lat here and separating the fibers and go cross fiber. This is a really good one that you can do cross fiber. You want to go along with the fibers and cross fiber. You can lift up with, if you can't do the skin rolling, you can even lift up with your thinner part of your hands. And then also you can stretch her arm. You can stretch her arm, hold the arm, and then just go down. You can glide from here down. I'm not using any oil today because we would make a mess with the paint. And I did the painting today, but at the end I was tired and I didn't do such a good job here because it really goes almost to the anterior part, the intertubercular groove of the humerus. So it goes here and underneath. So it's about right here. So you want to grab her arm and then go from the iliac crest all the way up to the arm. And it's all connected. You can do some of these strokes. You can also do some some squeezing here, or you can go from the opposite side too. Remember, you want to get the muscles from all the sides. Go up and across. Contralateral. I'm on the opposite side of the table, and I would also get with my finger pads, getting all the lats. Latissimus Dorsi, known as your swimmer's muscle. And I could also, get some of the QL and the Thoracolumbar Fascia. And then from this angle, I can also do some rocking here. See if there's any more movement than when I first started. And you can go on the side by the spinous processes too. And I like to go brace 2 fingers like this, go all the way down. And be careful, I'm short. I don't want the client's head, going up, rubbing up against me. So if you can, and you can reach and you have long arms, then you can do like the V. Do the V, go all the way on both sides, gliding down the lamina groove, all the way down to L5, where the lumbosacral joint is right here, and just kind of do some pushing here. This is another good one too that you can do to kind of loosen out that lumbosacral joint right here. Remember, ligaments connect bone to bone, and they're tight, they're hard. And actually, something I need to mention with pregnant women, when women secrete the hormone relaxin, it relaxes all these ligaments so that it can expand, especially the pubis symphysis, so it can expand when they're going to give birth. So women that are pregnant have a lot of problems with these ligaments. So it's important for you to work on them either when they're pregnant or especially after they've delivered, because a lot of these, they might still be loose and it might cause a lot of tension. So think of the back as a suspension bridge, so make sure, and these would be the cables, these are the towers. The muscles are the ones that hold the tension, that pull. So make sure you work this area. This is the communication between your upper body, your axial skeleton, and then your lower body. So all of this tension here, this is why people have so many back problems right here, just in this area here. So make sure you really address these. I'm going to turn her sideline because that's actually my favorite position to work on. So let's turn her sideline. Okay, so now that she's on the sideline position, make sure you have cervical support and her leg is over a pillow, just, to hold up her hip, because if not, her hip would be lower. So one of the things that you can do from this angle, and I'm going to show both sides, but what I'm going to do with my left hand is I'm going to go on this side of the transverse processes and then pull down here to create a stretch all the way from the lumbar all the way up the spine. All I'm doing is separating, pulling apart some of these muscles and ligaments that might be tight. And you can also do it on this side, just pulling towards yourself with my finger pads. I'm pulling towards me. I also like to use my little washer spoon. As I feel, make sure you're on the transverse processes, but you can pull up this way towards me. But this is all I'm doing, going up or down the lamina groove. Make sure you want to get the erector spinatus too, the multifidi muscles, but I'm just going down on the transverse, from the transverse processes out all the way to the L5, the lumbars. And remember on here's T12, this is where the trapezius ends. So the trapezius is only from here up. I'm going to do another video on the 3 parts of the trapezius. Today I really only wanted to focus mainly on the ligaments. But here's also the thoracolumbar fascia. You can also use the spoon just to kind of loosen it up here. And you can also pull away, if you can. With oil, you can, if you have lubrication, you can push it away from the transverse processes all the way down, okay, up and down. So here, your lat is beautiful right here, exposed beautiful. So you're going to have her open up her arm, and look at this. You can really grasp the lat. You can do some skin rolling, and it forms the posterior axilla. So all of this is the lat, all the way up to the intertubercular groove of the humerus, which is almost on the anterior part. So you can do some grasping, some massaging here of the lat, pulling it out. and also stretching it out. All I'm doing is holding here, you know, at the bottom part. Be careful here with the ribs. You can even do it from the ilium here, cupping the ilium. I cup the ilium with my hypothenar part of my hand. I hold it there, and then I stretch it out. She's small enough that I can stretch it out this way. Or you can come to this side too and pull her arm. Now another stretch that I want to show you is I'm going to remove the pillow for a minute. There you go. And you are going to drop your leg, but to the back. The top leg, drop it to the back off the table. There you go. See how that pulls everything from here down, even to the hamstrings. So you can kind of help it by stretching it out, or lean right at the ilium, not at the ribs. And her leg drops and pulls also the QL. I can also go to that side and pull from the ankle. You can also pull from the ankle from the opposite side. Okay, so now this is a great way to get to the QL, the Quadratus Lumborum, right here. So I drew it on this side, but it is underneath here, okay? So this is a great way to get to it from here. And I'm gonna go out about an inch and just push down on it. This is a great way to release that QL. Remember, your QL is your hip hiker. This is your hip hiker. So you can even ask your client to hike her hip. Let me see, can you move it? Yeah, hike your hip and relax. Okay, and hike, there you go, and relax again. Okay, hike your hip. And that can really engage. It engages the QL. Another thing that you can do is you can pull on her, you like go to the iliac crest right here, and then just pull down. That's all I'm doing is pulling down. Do you feel that stretch? Yeah. So all I'm doing is just pulling down, like trying to separate. Because a lot of times when people sit down all day, like there's hardly any space. I've had clients where the floating rib is almost touching the ilium. There's only like 2 inches here. And with people that sit down all the time, this compresses. So you want to make sure, this is all I'm doing is cupping the ilium and pulling down, just creating space. And this is another way to get to the sacrum too, and the sacroiliac joint. Here's the sacroiliac joint. It joins the sacrum with the ilium. A thing to remind you again, that the name of the ligaments, that it attaches 2 bones. So lumbo from the lumbar, sacral connects the lumbosacral. Sacroiliac connects the sacrum with the ilium. The iliolumbar, so it comes from the ilium to the lumbar. So all the ligaments are named after the 2 bones that it connects. So make sure you remember that. If you know your bones, you're going to know all the joints and most of the ligaments. So remember, this is how it all ties in. If, let's say, you hurt your arm and you've had surgery and you can't lift up your arm, well, the the lat right here where it inserts at the intertubercular groove is going to be tight, pulling. It's going to be pulling the lat, and it's going to come down, and it's going to pull on the QL and on the glutes and on the sacrum, and then down the sacrotuberous ligament, and then the hamstrings. Okay, this is how it all connects. Or it can start from the hamstrings. If you have tight hamstrings and a tight the sacrotuberous ligament, and then it pulls on the sacrum. This, I forgot to mention that the sacrotuberous ligament prevents the sacrum from tilting forward anteriorly, so it can keep it steady here so it doesn't tilt too forward when it's trying to keep your back straight. So if this is tight, the hamstrings are tight, the sacrotuberous ligament is tight, then it throws off the sacroiliac joint, thoracolumbar fascia, and then the lat and the glutes and the QL, and then the arm. So it connects. It can start from here all the way down, or it can start from all the way down, all the way up. This is how the whole body connects. This is why it's important, for you to work all the muscles that correlate and try to do some. I love the myofascial techniques, and I love the stretching techniques. And you can accommodate to your size. You know, I'm kind of short. But anyway, I just really wanted to focus on the ligaments. So this is the thoracolumbar fascia. It's like a little triangle, and it goes down to the sacrum. This is the sacrum. This is T12, L1, 2, 3, 4, and 5. The iliolumbar ligament. The lumbosacral ligament. The sacroiliac joint, and the sacrotuberous ligament that goes down all the way to, look, you can see it. It goes all the way down to the ischium. This is your sitting bone right here, and then to your hamstrings. Remember, it's all connected, and you need to stay hydrated too in order for the fascia to move. If you're not hydrated, your fascia gets stuck like glue. So hydration is important, and working on everything that connects is important, from the bottom up or the top down. It doesn't matter. Cross fiber is good. Skin rolling is good. Myofascial release is good. Anything you can do, let the body tell you what it needs. That's what I feel. This is how I teach it, you know. Your hands will be able to tell, and your client will be able to tell you what they need. If there's trigger points, remember, you work on them, you hold them, 10 to 12 seconds, up to 20 or 30 seconds max. Because if not, then you start, secreting endorphins, and you don't want to engage. You don't want to create more pain patterns. You're trying to break up the pain patterns. That's why it's important not to overwork the trigger points. So I hope this helps you, and that you subscribe and share and keep supporting us. I'm trying really hard to come up with new videos. Give me ideas, and I appreciate you guys. And until the next time, create a great day.